Well, the big story this evening, India has added over 58,000 new COVID cases in the last 24 hours, rising over 35% in one day. The overall positivity rate has crossed 4% after nearly 7 months. Maharashtra has reported the highest number with over 18,400 new cases, followed by West Bengal, Delhi and Kerala. The centre has issued fresh guidelines for home isolation for mild and asymptomatic COVID cases. Home isolation for such patients has now been cut from 10 days to 7 days from the time of testing positive, provided that there is no fever for 3 consecutive days. On the vaccination front, India's cumulative tally has crossed 148 crore doses so far, with daily inoculation surpassing the 1 crore mark for the second straight day. The pace of vaccination has increased after the government expanded its vaccination drive for all 15 to 17-year-olds. To take the conversation forward on where we currently stand in dealing with the Omicron crisis, we are now joined by Dr. S.K. Sarin, the Vice-Chancellor at the Institute of Liver and Biliary Sciences. Dr. Sarin is also head of the Delhi State COVID Task Force and a member of the National COVID Task Force. Dr. Sarin, thanks very much. Always a pleasure. Appreciate you joining us here on CNBC TV 18. Let me begin by asking you for your assessment of how different this wave is from the previous waves. The Delhi Health Minister today doing a fresh press conference saying that Delhi, for instance, is in the midst of the 5th wave. We are seeing a record number of patients. 10,000 patients is the likely count for positive patients that is expected today. But how different is the scenario in the ground in the context of what we experience with the Delta wave?
Thank you for calling me, but let me clarify, I'm not the head of the Delhi's task force on COVID. That is the LG and others. I just work at ILBS as a clinician and maybe sometimes for the Supreme Court mandated committee. My assessment of the situation is the numbers are likely to double up or maybe in every 2 to 3 days. Everyone's guess is same. And the reasons are twofold. First, that the virus is getting very rapidly progressive, very rapidly multiplying. And secondly, that we still have a large proportion of patients or subjects, I would say, who have not been vaccinated. But let us leave that for the time being aside. Those who are infected are already having 2 shots or have even got the virus in the past. So that is something which is very worrisome, and we cannot therefore ignore the fact. For example, somebody got COVID and got a lung disease. Now he gets Omicron. Suppose somebody had a transplant and got vaccines. Now he gets Omicron. This is a problem. So people think that Omicron is mild. It is not going to make the disease. It's a mild disease, which is not correct. In my mind, we should have a categorization for general people. Yes, it may be a mild disease, but for a large number of comorbid people, or those who have long COVID, or those who had a COVID-related illness which is persisting, a Omicron infection can become serious. So we should be aware of this fact. And secondly, also be aware of the reality that many people are not positive on the first time, they are positive on the second time. Therefore, anybody who goes to a hospital with a COVID-like illness, please consider that it is COVID unless proved after some time negative.
Right. So you are saying that if you are symptomatic, then assume that you are positive until a test report shows otherwise. And you're also saying that as far as the immunocompromised is concerned and people with comorbidities, they need to be
certainly,
extremely
I feel that
cautious.
If patient is symptomatic,
because while, yes, so they need to be very careful. But Dr. Sarin, what I want to understand from you, sir, what we have seen, for instance, is that the home isolation protocol has now been revised. It is a 7-day quarantine versus a 10-day quarantine that was the earlier prescribed norm. Do you believe that that is reasonable, given, as you point out, that for a large majority, hospitalization is not the need of the hour, so you're actually keeping hospital beds available for those who really require them? And also, this business of testing, even after you finish your isolation period, only adds to the backlog as far as the testing infrastructure is concerned. So doing away with that requirement also frees up testing capacity.
You're absolutely right on that. I think globally the protocols are being modified both by the US FDA as well as the CDC and also by the WHO. The reasons are clear, that the virus is in the upper respiratory tract, and maybe 5 to 7 days later, it is not that reproductive and may not be spreading that much. So these protocols of home isolation have been carefully done, and also it allows us to have some more doctors. If you have 2 weeks and a doctor has no symptoms but got positive, he'll be off work. So a nurse or a doctor or a healthcare worker, if he's off for 2 weeks, who's going to man the hospitals and the emergency areas? So in my opinion, this is okay. Yes, if symptoms are persisting, and that is what the US government,
Yeah.
the CDC said, if the symptoms are persisting, then this 5 days, 7 days is not there. But after symptoms have gone, I think it's a reasonable thing to say. And also now we have the new drug, molnupiravir. So if you give it, and it is only yesterday that New England published that if you have this drug taken and within the first 5 days, it really mitigates the seriousness of the infection, mortality, hospitalization, ICU going is clearly halved. So I think it's good, and we have this drug in India now. So why have longer period of isolation or longer
Yes.
period of staying home?
No, so Dr. Sarin, just on that issue, because again, this is something that a lot of people are confused about. If you're mildly symptomatic or asymptomatic but test positive, do you believe that the need of the hour is to take things like molnupiravir, which are now available drugs in India, or should you wait it out and be treated medically only on an SOS basis? As you point out, the first 5 days are crucial. Are you recommending that people who test positive, even if they're mildly symptomatic or asymptomatic, consider that as an option?
Well, that's a very good question, and this has been addressed both ways. Whether you continue the US module where people have been advised, anybody who is even asymptomatic, he can take the pill, and uh, even in UK, many of these, because they don't want to have symptoms, wait till the symptoms, because then it may be too late. So anybody who gets it in first, second day or third day, he's much better than you wait for fifth day when the symptoms may appear. So many of these countries have permitted knowingly or silently that yes, you take the drug, don't have symptoms, don't go to hospital, stay at home. That is one approach. But if you go very scientifically, do we give antivirals, do we give antibiotics without fever? This can be questioned. But if I were a one, I would take the pill.
Okay, so you're saying that you would consider taking a drug like molnupiravir, which will now be made available in India as well. Dr. Sarin, I also want to understand from you, because you talked about how the quarantine day period coming down from 10 days to 7 days will in fact ensure that we have more healthcare workers and frontline workers available. But how much of a challenge is it currently? What we are hearing from different states, and in fact, I was speaking with the head of the Maharashtra COVID task force yesterday, Dr. Oak. He said if in the first wave there was a bed shortage, in the second wave there was an oxygen shortage, this wave we're likely to see a shortage of healthcare workers because many find themselves already infected. How much of a challenge is that? What are you seeing in the capital, for instance?
I concur with Dr. Oak. It's a very clear and wise thought that he has, because somehow we do not have adequate boosters even now available for our healthcare workers. So we had, in fact, in the earlier meetings had suggested that the boosters to the healthcare workers should have started much earlier, but somehow the logistics and other thoughts, we are going to start from the 10th, and the another 2 weeks it will require for the antibodies to zoom up in those who get infected, get the booster done. So we actually practically would think that by end of January, our workforce will be ready. So I hope Providence doesn't make our healthcare workers go down by the end of January. They should be requested to be extra careful, cautious. But yes, there is a fear like 100 doctors, 30 doctors. If that is the way we get infections done, we may have to, struggle. But we have a large workforce. I am not despondent. I am quite hopeful that we will pass through this time. But yes, healthcare workers have to be extra cautious, maybe every time a double mask, no letting down. And also, don't, my friends, eat together. Even if you are off duty, when you're going home, just be alone and not have that freedom for at least till the time you have booster and you have good antibody levels.
Yes, and the boosters will start from the 10th of January. That's when the rollout is expected to start. We're still awaiting a formal announcement on what vaccine will be used for the precautionary dose. Will it be Covishield and Covaxin? Or will we see the inclusion of Covovax and Corbevax as well? We're still awaiting final details from the central government on that. But Dr. Sarin, you talked about the challenges of having a ready workforce. But what about hospital infrastructure? What we are seeing globally is that while cases are at record highs, hospitalization is still not as high as what it was during the Delta wave. Now, because we are seeing large numbers being infected at the same time, the fear is that hospital infrastructure will also be overwhelmed. But I would imagine that as a member of the task force in Delhi, you've been reviewing the situation. So far, it seems things are under control. What's your assessment of the infrastructure available?
Well, I think nationally there has been an immense improvement. We have now the oxygen cylinders. We have the complete oxygen supply available. The infrastructure for distribution is in place. So I think oxygen will not be a problem. You have local oxygen generating centers in the hospital. So all of us have that with us. The problem certainly can come if we have children who come. I think enough infrastructure, pediatric infrastructure has been developed, but since the kids have not been as of vaccinated and do not have antibodies, and in the US, the maximum worry now is that the kids 4 to 5 times more getting infected, and maybe the hospitalization in them is higher. So all other infrastructure, manpower is ready, but I think we need to pay extra attention. We have the guidelines, all of them, how to treat, how to handle the kids, pediatricians and the lung specialists, they all are ready. But just, this is an additional caution that I would like. I think our hospitals, our beds, our nursing, our drugs are all in order. But if you take the total number of people who got positive, versus those who were positive in Delta, the number being 5 times more, you may have probably equal number of people going to hospitals in future. Another 3 to 4 weeks will tell us where we stand in this particular area. It's not the actual percentage, but total absolute number of patients might, become more.
Number.
Yeah. Okay.
Yes, that is correct. That is the cause of concern, that we might see a significant number being infected and at the same time. And we're already seeing the doubling of numbers across large metros over the last few days. But Dr. Sarin, as far as Maharashtra is concerned, the expectation is that for a city like Mumbai, it's likely to peak around the 15th of January. Is there an assessment of or models that have been presented to the Delhi task force in terms of what the trajectory is likely to be as far as the capital is concerned?
I would not be knowing what has been presented at the Delhi task force or DDMA meeting, but my own guess is we are still on the upper cusp. We are still going up. And if the R is 1.7 or more, it is unlikely that we will see. Logically, for this virus, we will see at least 4 to 8 weeks of the time when it is going to still either going up or remain at peak. It would be very heartening if it comes down by this, but the practical assessment is that it might be early February by the time that we start to stabilize or so. So we should be ready for another 3 weeks or so before we can say, yes, we are on the lucky side of the goddess. But it's a time.
Yes, the next few weeks are going to be challenging